whom has cerebral palsy, have successfully sought employment and are able to live more independently in their community thanks to the Medicaid waiver. For a friend in Louisiana, I only know through Facebook because of common medical struggles, whose son, Carter, has global developmental delay and multiple medical conditions due to a rare disease he contracted at only 3 months of age. And for my friend right here, who literally and figuratively has my back, the mother of Eliza, a beautiful 11-year-old girl who was born blind and has cerebral palsy and microcephaly right here in Virginia. And for my own precious daughter with Down syndrome, who had successful surgery in August of last year and for the first time ever is attending school full-time and speaks with pure joy about the friends that she is making there. As a parent, absolutely nothing else matters when your child is sick. Your world shrinks and everything else just falls away. I would have sold my house, my car, really done anything to make sure that my daughter had access to the care that she needed. No parent should ever have to have that worry, and they're going to have the life-saving provisions and care that their child needs to afford bankruptcy. The Affordable Care Act quite literally meant the difference between death for my daughter and also for financial stability for my family, and it has given us a chance to seek a financially secure life that we would have been hard to achieve otherwise. Senators, I urge you to do whatever necessary to preserve the provisions of the ACA, including the elimination of lifetime caps, protection for those with pre-existing conditions, and coverage for essential health benefits. I also urge you to reject any cuts to Medicaid funding, including block or per capita models that would reduce access and services for persons with disabilities, low-income households, seniors, expecting mothers, and others. I also urge you to encourage access to health care coverage because it is a lifesaver for Americans, and we must do everything we can to keep insurance accessible, affordable, and comprehensive. The stakes are just simply too high. Thank you, Senators, for your time and consideration.
Thank you so much, and we apologize for the microphone going on and off for you. I'm not sure what that's about, but thank you so much for your testimony. And Mrs. Walkington.
Thank you so much for inviting me to be here today. I'm honored that I get to share my story with all of you. My name is Gina Walkington. I live in Bristol, Wisconsin, and I am a mother to 3 rambunctious, energetic, amazing boys. I'm here today because I know that if I didn't have access to Planned Parenthood in my 20s, I wouldn't be a mother today. In 2006, when I was 20, my best friend and I made appointments to get exams at Planned Parenthood. We went to Planned Parenthood for a few reasons. At 20, I was underinsured. Although I was insured through my parents, the topic of sexual and reproductive health was not something that we were really was ever discussed or we were comfortable talking about. And the sliding scale and privacy of Planned Parenthood was essential to me as a 20-year-old woman. A week after my appointment at Planned Parenthood, and at that appointment I had a Pap test, STI testing, and got a supply of birth control. A week after that appointment, Planned Parenthood called me to explain that my Pap test had come back abnormal and that they had found precancerous cells in my cervix. For a 20-year-old woman in college, that's a terrifying thing to hear. So many things run through your head when you hear precancerous cells. And in addition to other fears, I knew that if it was left untreated, I might not be able to have children. At that time, as a 20-year-old, I hadn't really thought about kids. I wasn't sure that it was even something that I wanted, but when faced with it possibly being taken away, it suddenly becomes very precious to you. The clinician at Planned Parenthood walked me through what to do next and helped me move quickly so that the cells didn't have a chance to spread. I quickly had a LEAP procedure done to remove the cells and am now a healthy mother of 3. Had Planned Parenthood not been so easily accessible and affordable for me, my life may have turned out radically different. Had I waited to get care, had the cells continued to develop, I could have lost the ability to have children or even died. Planned Parenthood's preventative care is what saved my life. I'm not the only person that can say that. Another woman I met who lives in Wisconsin, her name is Christy, also went to Planned Parenthood to get a Pap test in her 20s. But for her, the cancerous cells were far more developed and widespread. She had to have several procedures to have them removed, and thankfully is in remission and with us today, but is not able to have children. If she were here today, she would tell you that Planned Parenthood saved her life too. Planned Parenthood provides cancer screenings to more than 650,000 people every year. Nearly 72,000 people have had their early stage cancer or precancerous abnormalities detected at Planned Parenthood in 2014 alone. I joined with 4 of those women to start the Cancer Survivors Network of Planned Parenthood to bring attention to how essential Planned Parenthood is for making cancer screenings accessible and affordable. Through the network, I've met a woman from rural northern New York who couldn't get an appointment to check out the lump in her breast for 3 weeks, but she called Planned Parenthood and they got her in that day. I met a woman from South Carolina who was just 19 when Planned Parenthood clinician found a football-sized tumor on her ovary. We are just a few of the thousands and thousands of women whose lives have been changed by Planned Parenthood. The American Health Care Act would block people who rely on Medicaid from going to Planned Parenthood for cancer screenings, birth control, and other preventative care. The Republicans supporting this bill have suggested that those people could instead go to community health centers. In House Speaker Ryan's district, where I live, there are 2 Planned Parenthood health centers and 2 federally qualified community health centers that provide screenings and birth control. The community health centers have said publicly that they would not be able to accommodate the patient load from Planned Parenthood as they already are overloaded and refer many patients to Planned Parenthood. For women, reproductive health should not be treated as a luxury. It is essential. Every woman deserves access to the kind of expert care that Planned Parenthood provides. It is irresponsible and dangerous to block access for a woman just because of where they live or how much money they make. When I think of Planned Parenthood, I think of my 3 boys, who I'm thankful to have because of the care I received. I am here today because 11 years ago, Planned
important personal stories. And to Ms. Hardaway, thank you for coming from Maryland's Eastern Shore to tell your story. And I believe, along with my colleagues, that it's going to be that personal testimony that you all provide that will turn the tide ultimately, because we can talk about the statistics and all the cuts in dollar terms, but you can tell that story in human terms. So my colleagues, Carol Fisher Hardaway is here from Salisbury, Maryland, to tell her story. Thanks for being here.
Thank you so much. Please proceed.
Thank you. Madam Chairwoman, distinguished senators, thank you for convening this critical hearing and for the opportunity to share what the House Republican Health Repeal Bill would mean for me and my care. I look forward to testifying before you today. My name is Carol Hardaway. When I was 32 years old, I reached into my baby's crib, only to realize I couldn't feel him. My arm felt like it was asleep, like I must have slept on it wrong. I grabbed my son with the other hand and didn't give it much of a thought. Within minutes after arriving at the bar for work, I couldn't hold the glasses and shakers I needed to do my job. It was almost as if someone had flipped a switch in my whole right side and it shut off. Something was wrong, and I needed to go to the hospital. When they tested me for everything, stroke, meningitis, you name it, the tests were inconclusive, so I was sent home a week later with no diagnosis. This was January 1986. 4 years later, I had issues with my vision. It began rapidly deteriorating, taking me from near perfect vision to near legally blind. I went to an optometrist who didn't know what was causing this woman in her 30s to lose vision so suddenly. He passed me on to an ophthalmologist, and then on to a retina specialist, and then a neuro-ophthalmologist, who did an MRI. The scan showed tiny, yet telltale black specks on my brain, lesions, clearly multiple sclerosis. Quite a diagnosis for a single mother whose only son was about to turn 5. As you know, multiple sclerosis, or MS, is a debilitating nervous system disorder. There is no cure. For me, it has meant reduced mobility, fatigue, excruciatingly painful spasms, and the occasional attack, which is an intense period of heightened symptoms. Those days, sometimes weeks, are the worst. To be clear, MS does not define me, but it does inform how and where I live. Allow me to explain. Back in 1995, I lost my health insurance when my then husband and I started our own business. From that point forward, I was uninsurable. Along with my debilitating chronic condition, I've survived 2 heart attacks, not exactly the type of risk you want in your books. Funny story, when I tried to qualify for the Texas high-risk pool, which was terrible insurance, by the way, I needed declination letters, yes, declining letters from health insurance companies. Shouldn't be too hard, right? Yes, is this XYZ company? I'd like to enroll in your plan. Female, non-smoker, existing health conditions. Oh, 2 heart attacks, high blood pressure, depression, and multiple sclerosis. Every insurer I called laughed at me. That was what health care in America meant before the Affordable Care Act. That all changed on March 23, 2010, when President Obama signed ACA into law. I could not be more grateful to him and every senator, staffer, and advocate in this room who made that happen. Thank you all from the bottom of my heart. My health continued to deteriorate, but I finally had hope. At that point, I was walking with a cane and couldn't always put my own pants on. I had to bring a stool to garden and pick up pecans because I wasn't sure I'd be able to get back up. I would pick up shifts waiting tables in town to pay the bills, but I couldn't always go in, and sometimes when I did go in, I'd fall, taking lunch plates and my dignity down with me. When the Supreme Court gave governors the option to reject Medicaid expansion, Rick Perry chose politics over the people of Texas. It became painfully clear to me that the only way I was going to be able to get care, and it was becoming urgent, was to leave my home and move to Maryland. On January 19, 2014, my son showed up to my home in Salina, Texas, with a moving truck. The high school football team came over to help load the truck. Go Bobcats. And thus began my 1,400-mile journey to receive quality, affordable health care. Within 2 weeks of moving to Maryland, I started receiving treatments for MIMS, 24 years after my initial diagnosis. This is all thanks to the Medicaid expansion. My weekly shot manages my symptoms and significantly cuts back on my spasms. Because of this, I'm able to work as a very proud substitute teacher in Wacomico County Public Schools. When my health declines, usually every 6 months or so, my neurologist orders an anti-inflammatory steroid infusion. This dramatically improves my mobility, energy, speech, and overall function. As fate would have it, I just got my infusion last week, and look at me, I'm a whole new woman. The House Republican Health Repeal Bill cuts Medicaid, even after President Trump promised the American people he wouldn't. Under the Republican plan, I would be the biggest loser. Not only would I lose my Medicaid, the new age tax and ending protection for pre-existing conditions would make coverage or treatment completely unaffordable. I'll tell you the same thing I told my Congressman, Andy Harris, before he shut off his phone lines. The House Republican Health Repeal Plan would put me in a wheelchair. Those who say Medicaid is broken don't know how it has fixed me. Let me be clear. Just as I stand here before you, as a 63-year-old working woman with MS, Medicaid expansion is working. Don't let them tell you that I can't see a doctor or a specialist or a hospital or a pharmacy. Not only am I not having any problems with the coverage, Medicaid expansion is my lifeline. You have got to save it for me and the millions who depend on the coverage. Fight like hell, because we will be fighting like hell right there with you. With that, I would be happy to answer any questions you may have. Thank you.
Bravo!
Thank you. Thank you, Carol. Thank you to all of you. You reaffirm and energize us, and thank you so much. Dr. Dunkley, Mr. Dunkley, yes, thank you.
Thank you. Good afternoon, and thank you to Senator Stabenow and the DPCC for inviting me to participate today in this discussion. My name is Michael Dunkley. I'm 64 years old, and I live in Alexandria, Virginia. And I am here today to tell you my experience with the healthcare system over the last several years. In the summer of 2013, I was experiencing an increasing series of back pains, which I attributed to just my declining physical condition. But over the summer, it became worse and worse. And your story is so resonant because my wife of 37 years has been battling multiple sclerosis for 24 of those years. And her condition is actually in a more advanced state. She has what they call secondary progressive. So she has been on the disability insurance for some years now, and I am her caregiver. So she convinced me to go see a doctor. He initially thought it was going to be a hernia. They did a CT scan, and on Friday afternoon, an hour after I got home, phone rang. It was his office. They said, the doctor wants you and your wife in his office at 9 a.m. Monday morning. And would you like to speak to the doctor? And I'm sure. And so he got on. He said, forget the hernia. You've got masses all over your chest wall. You're going to have to start thinking differently. Have a good weekend. So Monday morning we go in, and he throws up a bunch of stuff on a screen and just turns and says, this is lung cancer, 3rd stage. Who's your oncologist? Just boom, boom, boom. Well, he got me to see an oncologist immediately, and after a week's series of many, many tests, it was determined that I had non-Hodgkin's lymphoma, large cell, stage 4. I asked my oncologist what was stage 5, and his office overlooked Arlington National Cemetery, and he said, that's stage 5. And that is where my father, a Marine Corps officer, is buried, who died from multiple sclerosis. So we have these threads weaving together. I was put immediately on this very powerful 5-component chemotherapy session, and within a day or two after that was the first day that you could register for the Affordable Care Act, Patient Protection and Affordable Care Act. I got 2/3 of the way through the system. It stopped working, but I knew that it would not take effect until January 1st. I'd have a chance to sign up. The other thing that was running along this, at this point I was unemployed, and I was paying for medical insurance through my COBRA plan, which was $875 a month. In early December, I spoke with a representative at healthcare.gov, and in 15 minutes I was completely registered. I had a brand new plan that would take effect January 1st. So on December 31st, my COBRA expired. A minute later, I had a new plan that with the subsidy, I was paying $575 a month, which was less than the $875, but I also had a plan that had a 0 deductible and an $1,850 out-of-pocket limit. 3 days after that policy started, I had my 5th chemo that generated charges of around $35,000. I had another round of chemo, and on February 14th, 2014, my oncologist informed my wife and I, it was Valentine's Day, that I was somehow in 100% remission. What the internal medicine guy had thought was lung cancer was actually this membrane cancer had spread throughout my body, covering my lungs, my stomach, it was going down my throat. The bulges were due from lymph nodes that are normally the size of a grain of rice to the size of a lemon or an egg, and they were crushing my vertebrae, my spine, my ribs. So that very initial series of transfers that the Affordable Care Act gave me got me through the first chemo. Since then, because of a problem with the chemo, both of my hips broke and had to be replaced. That generated probably another $140,000 in charges. I continue to have these PET-CT nuclear scans, which are $5,000 a pop. But the bottom line is that I am in remission. I am able to continue my life's joy of loving my wife and taking care of her, helping her. And again, I am just so honored to be able to speak out. There are millions of voices, stories far more complicated, but they all come down to a bottom line, is that we are all sailing on this ship of life together. And you're on the voyage, so let's help everybody as we go along. But getting back to the Affordable Care Act, and I say Patient Protection and Affordable Care Act because both components protected me, that I could not be declined for a pre-existing condition. I was in the middle of chemo with massive cancer everywhere. They wouldn't have given me a policy, or I would have to come up with the cash to pay for the procedures, $35,000 here, $5,000 there. So it protected me. It was affordable. Now, I will turn 65 next month, and I will be going off the exchange and going on to Medicare. And I am just optimistic that that will continue to exist. Because really, to be honest, I think the only way that we can endure is with a single-payer system, where every other nation basically on earth has something like that. And to invest in the health of the people makes the body politic healthy, and the nation will thrive. And when people are sick, they can't function, they can't perform, it's a drain. And I really look forward to this session, and I look forward to actually seeing the Patient Protection and Affordable Care Act strengthened rather than jettisoned. Thank you very much.
Thank you so much, and we are so pleased that you are here and doing well. Commissioner Miller, welcome.
Thank you. Good afternoon, Chairwoman Stabenow and members of the Senate Democratic Policy Committee. Thank you so much for the opportunity to be here today. I applaud the committee for holding this hearing today to highlight the significant impact that repealing the Affordable Care Act and replacing it with the American Health Care Act will have on millions of Americans. And I'm just really honored to be on a panel with so many brave people next to me. Before the ACA, sick people often couldn't get health insurance due to a pre-existing condition, or if they could, they paid significantly more for it. Individuals with catastrophic or chronic medical issues could face annual and lifetime limits that left them financially devastated. Women would often see higher coverage costs than men and perhaps not have access to contraception or maternity care covered. Critical services like mental health and substance use disorder treatment and services like prescription drugs were often difficult, if not impossible, to find coverage for. Most importantly, more than 10% of Pennsylvanians and more than 16% of Americans nationwide went uninsured. Since the ACA's passage, the national uninsured rate has fallen to 8.6%, and Pennsylvania's uninsured rate has dropped to 6.4%, the lowest it's ever been. And in my written testimony, I provide statistics on how millions of Pennsylvanians have benefited from the ACA. And statistics are important. But as this hearing demonstrates, what's absolutely critical is that we don't lose sight of the fact that behind these statistics are real people, real human beings that will be significantly impacted by changes made to our healthcare system. I'm not going to sit here today and tell you that the ACA is perfect. It's not. But the narrative that the Republicans in Washington are pushing, that the ACA is failing and unless Congress takes action, it will implode, is just false. Millions of Americans have benefited from the ACA, and the employer markets, where the majority of people get their insurance, have actually seen a moderation of costs since passage of the ACA. Now, there are legitimate issues with the individual market, but this is a small market, generally covering about 5% of the population, and this is also the market heavily subsidized through the ACA. I generally hear from the 1% to 2% of Pennsylvanians in this market who don't have access to financial assistance. It's this very small population that the market may not be serving as well today as it could. While individual markets are facing issues, in some states more than in others, in Pennsylvania, I can tell you that the market will not implode unless the federal government takes adverse action, like refusing payment for cost-sharing reductions that would cause it to implode. Unfortunately, instead of having a conversation about how we make sure everyone in the individual market is served well by the system, in other words, solving a real problem, we're here talking about repealing the Affordable Care Act and replacing it with a system that could result in 24 or more million people losing their health insurance. With that context, I want to offer some comments on a few specific aspects of the bill that passed the House last week. There's been a lot of talk and a lot of confusion about how the AHCA does or does not protect people with pre-existing conditions. Many of the Republicans who voted for the AHCA insist that people with pre-existing conditions will not be adversely impacted. I respectfully disagree. With the addition of a last-minute amendment to the bill last week, states now have the option to return to a pre-ACA world where insurers are able to discriminate against people with pre-existing conditions by charging them more for coverage if they had a gap in coverage. States would also be able to opt out paying more for less robust coverage. States that receive these waivers would be required to establish high-risk pools to provide coverage for sick people. But historically, high-risk pools have not proved to be an effective way to cover high-cost individuals. If you look closely at the experience of the 35 states who had high-risk pools before the ACA, as well as the federal government's experience running the pre-existing condition insurance plan, one thing is clear. There doesn't ever seem to be enough money to run these high-risk pools in a way that truly protects people with pre-existing conditions. So you end up with high premiums, coverage limitations, and even enrollment caps to address these funding issues. The AHCA attempts to address premium costs by removing requirements that insurance companies offer plans with certain levels of cost sharing. Allowing plans with higher levels of cost sharing, like higher deductibles, may make coverage less expensive, but all it does is shift the cost to consumers who will see higher out-of-pocket costs when they go to access care. Additionally, the AHCA moves away from subsidies based on income that help lower premiums to flat tax credits based on age and eliminates altogether additional assistance that currently helps low-income Americans pay for their out-of-pocket costs. It's hard to see how these changes taken together don't result in a return to the pre-ACA world where more people struggle to pay medical bills or opt to go without care because they're concerned about the costs. The ACA is not perfect, but the AHCA is not the answer. Instead of talking about a plan that will result in at least 24 million Americans losing their insurance, reducing benefits covered by insurance, and shifting the cost of care to consumers, we should be talking about common sense changes to our current system that will stabilize the individual markets and ensure the promise of the ACA, access to affordable, quality health insurance and health care, is a reality for all Americans. Thank you.
Thank you so much. And before turning to Mr. Nelson, I know that Senator Maggie Hassan is going to have to leave and wanted to say a few words. And we
well, thank you very much, and I do regret that I have to leave, but I did want to just thank all of the panelists who have spoken, and Mr. Nelson, I will get a report on your testimony. Just to echo what my colleagues have said, when people throughout our country stand up and speak up about what their real experiences are like, that's what enables us all to make change. And I share some of the experiences of some of you at the table. Mrs. Johnson, thank you for your testimony. We share special children. And so I look at healthcare from the perspective of a senator, a former governor, and a mom of a young man whose cerebral palsy and condition is stable now in his late 20s, thanks to the health care he's received. So you're all speaking about the value of health care to all of us as individuals, to us as a community of Americans who know that we need to be healthy and strong together in order to thrive together and in order to lead as a country. And so I'm very, very grateful to all of you, and I look forward to working with you and so many other Americans who are speaking up about their experiences, speaking from their hearts about what the ACA has meant to them, and commenting, Commissioner, as you just did, about the fact that the ACA isn't perfect, but there are ways to improve it. Lastly, just because it's the priority that I bring to the Senate on behalf of the people of New Hampshire, it hasn't been covered in today's testimony, but Medicaid expansion made possible by the ACA is absolutely critical to New Hampshire's capacity to fight the heroin and opioid crisis that is just ravaging our state. And so I want to make sure that I'm expressing for all of my constituents how important the ACA is as we combat a terrible epidemic that so many other states are facing too. And I thank you for being such strong advocates today. Take care.
thank you so much, Senator Hassan and Mr. Nelson. I recognize that chart. That's the Upper Peninsula of Michigan.
Yes, it is, Senator.
All right. Rod, please, go ahead.
Well, Senator Stabenow and members of the committee, thank you for the privilege. Thank you. My name is Rodney M. Nelson. I'm the president and CEO at the Mackinac Straits Health System in St. Ignace, Michigan. Our main campus, built in 2010 with USDA Rural Development Funds, a critical program, includes a 48-bed nursing home, a 15-bed critical access hospital that provides 24-hour emergency room care, primarily for rural patients within a 25 to 30-mile radius, and the millions of visitors that come to the Straits region annually. We also operate the Mackinac Island Medical Center, the Mackinac City Medical Clinic, Riverside Medical Clinic in Sheboygan, and the Straits Area Pharmacy, which is opening mid-June with the support of the 340B discount drug program. It would not have happened without it. And for the first time in 18 years that I've lived in St. Ignace, our community will have access to prescription services on Saturdays and Sundays, so they don't have to drive 60 to 100 miles round trip to the Snyders and the Walmarts and Sault Ste. Marie, Sheboygan, and Petoskey communities. We're unique in that the second floor of our hospital is occupied by the Sault Ste. Marie Tribe of Chippewa Indians Tribal Health Services. It's a unique partnership. They donated the land our hospital is on. They contributed funding. They are a separate entity. They are licensed separately, accredited separately, but we work together, and we actually share a boardroom together as a symbol of the relationship. Additionally, we have patients who travel up to 70 miles one way for chemotherapy in the Upper Peninsula. There are communities like Trout Lake and Curtis, Michigan, that are 35 to 50 miles away that we serve. We also provide outpatient surgical services for the first time in the community since 1980, so our community doesn't have to travel for basic surgery services. If significant provisions of the Affordable Care Act are stripped away, Mackinac Straits will anticipate cuts into the millions of dollars. Among the services that could be discontinued, and we put this together quickly, could be the chemotherapy program I just mentioned, a pediatric program that employs a physician assistant and a part-time physician, a 7-day-a-week walk-in clinic, and the services on Mackinac Island would have to be drastically cut back. The American Health Care Act has recently passed by the House, will be detrimental to my community's health system, to patients in every Michigan county, and to hospitals across the state. Not only does the AHCA reduce funding for Medicaid expansion, it reduces funding for traditional Medicaid programs as well. Here are a few data points. In Mackinac County, where our main campus is located, 7.9% of our residents under the age of 65 are enrolled in the Healthy Michigan Plan, Michigan's Medicaid expansion. Because of a trigger of the provision in our Medicaid expansion law, Michigan is most likely to lose the Healthy Michigan Plan effective January 1, 2020. Under the AHCA, this means 7.9% of my community loses its coverage overnight. Additionally, this does not include those who will lose coverage under changes that could be made to our individual market and the cost of coverage there. This is immensely frustrating after the effort we expended in the Eastern Upper Peninsula to enroll eligible individuals in the health care benefit. 3 hospitals in the Sioux and Newberry, St. Ignace, the Sioux Tribe, work together to do this. On average, Michigan hospitals have seen a 50% decrease in the number of people coming to the hospital without an insurance card. In other words, if 100 people came without a card in 2013, in 2015, it was only 50 people coming to the hospital without some type of coverage. The AHCA likely undoes most of that progress. As March 2017, Mackinac County had a 20.5 unemployment rate, 20.5%. We are 83 out of 83 in the state of Michigan. Recently, the Healthy Michigan Plan for our current and future patients makes a huge difference to their ability to maintain their health, to find employment, while our area continues to struggle with economic recovery. The AHCA is doubly cruel because Mackinac Straits Health System is the largest employer of the county, with 300 full, part-time, and per diem employees and a payroll in excess of $14 million. That's in a county of 11,000 people in a town of 2,500. 50% of the hospital is invested in our 50% of the operating costs are vested in our employees. The AHCA eliminates health benefits for the people who can least afford it, and at the same time continues to reduce Medicare reimbursement for our overall health system. Overall, Michigan hospitals will give up $10 billion in Medicare reimbursement between 2010 and 2026 under the Affordable Care Act. This is the hospital contribution to coverage expansion. While the AHCA eliminates the bulk of coverage expansion in Michigan and also makes cuts to our existing program, it keeps cutting the hospital reimbursement. Michigan hospitals keep paying for coverage that no longer exists. Between 2010 and 2026, the 24 hospitals in Congressional District 1 will see Medicare cuts of more than $500 million. These funds were intended to expand coverage. By expanding coverage, hospitals would retain the revenue necessary to retain our staff and clinicians, despite the Medicare reductions. If hospitals continue to experience reductions in reimbursement and our patients lose health care coverage, accessible health care services will not be available for our communities. Since 50% of our operating expenses for salary and benefits, it's obvious that we cannot afford to find adequate savings to offset this tragic financial impact. Mackinac Straits Health System is an economic engine for the Straits region. We are vested in a healthy community and the ability of our patients to obtain health care coverage. Access to health care services when they need it is critical in Mackinac County. It is not a wealthy area, as evidenced by our high unemployment rate noted earlier. One illness can bankrupt a family. One family's bankruptcy can mean the end of a small business, job loss, more downward pressure on the overall economy. The AHCA threatens coverage and threatens our health care system. It's that simple. Thank you.
Thank you very much, Rod, for that testimony. And before we now turn to questions, and we'll call on colleagues in the order of their coming into the room, and myself, and then Senator Murray, and then we'll proceed with other colleagues. I do want to welcome people who have been live streaming. We're glad to have you with us. We've had several thousand people so far that are tuning in, and we would welcome you to join us in the conversation by joining hashtag America Speaks Out or hashtag Trumpcare, and we want to continue the conversation. Mr. Nelson, I'm really glad you mentioned jobs. Obviously, the most important thing is access to affordable quality health care, but this is also an issue of jobs. And we know that under what the House Republicans passed, we're told that this could cost us 3 million jobs across the country. You are the largest employer, as you said, in your county. I assume that for a lot of other communities that I know well around Michigan, that's the same thing, right, in other communities as well?
That's correct.
Yes, and so if you're not there, then the doctors aren't there, the health care is not there, and the jobs aren't there. I did want to ask you about another impact, though, because you have a great 48-bed nursing home. I'm pleased to work with you on developing that, and I'm wondering about the impact of the Medicaid cuts on your nursing home and the patients that you serve.
You know, I asked that of our administrator. We're really proud. We have a 5-star rated facility, and it took about 5 years to get that through the dedication of our staff. And I asked our administrator, if we have cuts, what's going to happen? He said, you've got 2 choices. Either you want good care, or our residents are going to suffer, because where do you cut in a nursing home? You cut the staff. I mean, that's the only place you can really cut. So I think if let's see, 95%, we have 48 beds, what kind of care can we give or expected to give if we can't pay our employees? I mean, either we're going to invest and take care of our seniors, our most vulnerable, or we're not. And I just don't understand. There's not a choice here.
I understand, and we know that the majority of those in long-term care and nursing home care are receiving that care through Medicaid, so this is very serious for seniors. Thank you. Mrs. Walkington, thank you again. If Planned Parenthood didn't have a clinic in your area or didn't exist at all, how would you have gotten your health screening?
I believe that I wouldn't have. At that time, when being 20, I wasn't thinking that I was going to get the results that I did. The driving force to going was having a place like Planned Parenthood that you could get birth control and STD testing, at low cost, safe screenings, and private, judgment free. So I really believe that I would have just waited. And if I did, who knows where I would be.
Well, we're glad Planned Parenthood had a clinic and that you didn't wait.
Thanks.
So, thank you. Mrs. Hardaway, could you talk a little bit more about your experience in the high-risk pool? We're hearing all of this talk about pre-existing conditions are still covered, even though we know as a fact that that's not true in terms of it being part of insurance and not costing more and maybe even bankrupting people in the process. But could you talk a little bit more about what your experience was?
Well, when I first found out about the high-risk pool, I thought, well, there's an opportunity. And looking into it further, it required a $15,000 annual deductible. Well, I haven't made $15,000 a year for a long time because I fall into the gap. It also was approximately $600 a month premium. Well, with the treatments that I'm now receiving through the Medicaid expansion in Maryland that I could not receive in Texas, one of those treatments would cost $15,000. Just one. Wow. And so the high-risk pool, yes, it's high risk, but it's also very, very high cost and absolutely forbiddable. So I couldn't have afforded it even if even if it was available.
Thank you very much. One more question, and then I'll turn to Senator Murray. Mr. Dunkley, you were diagnosed with cancer when you were in your early 60s, and we know that the Trumpcare plan would allow insurance companies to discriminate based on your age and charge you up to 5 times more, or if there's a waiver, even unlimited amounts of money. What would that kind of an age tax on your health care have meant to you and to your family?
Well, taking January 1st, 2014, my COBRA had expired the night before. That plan was $875 a month. I had a $15,000 out-of-pocket limit and a $7,500 deductible, but I had a health plan. If an insurance I would have had to have paid for the process myself without insurance, but if it had been a 5 times greater cost, the plan I was on was a platinum plan that I chose through healthcare.gov. My portion was $575. The normal cost is about $1,100. So multiply that times 5, it would put it $5,500, close to $6,000 for a month's worth of health care, which is actually less than, again, with the deductibles and the out-of-pocket. It's just catastrophic. You're under so much strain when you're diagnosed with cancer, especially stage 4, that you become sort of focused on just every moment of every day. And to have the knowledge that, again, during that time when healthcare.gov was about to take effect, that gave me a few nights restful sleep. Without knowing that that was going to happen, if things had stayed the same, despair, just anguish. Again, my wife was taking care of me for a while there during that chemo. I couldn't walk. I lost 30 pounds of muscle mass in 30 days. It was pretty rough. But this new plan, such as it is so draconian in the way that it distributes the pain. We're all going to experience pain in life the longer we live. And to me, these are questions that almost shouldn't even be asked. As a child, my favorite story was The Emperor's New Clothes. When you just see something that is so obvious that that person is ill, let's help them. And it doesn't come down to ideology or anything. It's just basic human decency and empathy. And that's what I felt was totally absent in what has been proposed, with no hearings affecting 20, 30 million Americans, and they don't even have a hearing? As far as I understand, the amendment process was very limited. I mean, it just, the dead of night, literally, this thing appears. And to be honest, from what I've read, I can't even find a copy of the current legislation because it doesn't exist on the Capitol website because of the amendment. They don't even have the final PDF. So we don't know what's in it per se, but the Senate plan that is going to materialize somehow, there are no female members of the staff. I understand there are female senators, as far as I can
There
tell.
are, yes, there are, yes.
And again, as was said earlier, this is a non-starter. The Patient Protection Affordable Care Act has worked. It's not perfect, but it is a step in the right direction. But again, it just comes down to basic human decency for our fellow citizens, our fellow travelers on this great voyage. And a healthy comrade, compatriot is, you walk forward together. It's not zero sum.
Thank you
For me to
so
advance,
much.
you don't have to retreat. So thank you.
Thank you. Senator Murray.
Well, again, thank you all so much for sharing your testimony and your stories. And I'm listening to you, and never expected to have a child on Medicaid. And I hear so many derogatory comments here from people about Medicaid. Well, we can cap it, we can cut it, those people can get a job. I mean, we should have a big banner here that says, "There but for the grace of God," and remind all of us what can happen. So I appreciate you sharing that, and we need to remember that. Mr. Dunkley, Ms. Hardaway, your stories hit me personally because my father was diagnosed with multiple sclerosis when I was 13, 7 kids in our family. He never expected that. My family didn't expect that. Had a huge impact, and this was, of course, long before ACA benefits. And I remember my parents struggling so mightily, being turned down by insurance companies, not going to the doctor. My mom fell and broke her foot once and never went to the doctor, limped around for months and even years, but never got her foot set because it was one more bill they couldn't afford. So this was before ACA. This is America. We shouldn't have that. I remember asking my parents one time, how are we going to get through this? And my mom said, "We're crawling to Medicare." And she was in her 50s. So we don't want to go back to that, and we shouldn't have to go back to that. We are a much better country than that. So I really appreciate your coming and reminding us all of how there but for the grace of God, and that we have a responsibility to make sure that no one in this country lives hoping to crawl to Medicare. So thank you, all of you. Ms. Walkington, thank you for talking about Planned Parenthood. It's sort of been lost in the fog of all the other things that have gotten out, but the fact is that the House bill will take 2.5 million people away from access to health care. And you talked about it, the privacy that's so important is why you went there. But what I hear the rhetoric here around is, well, you will find another place. You can go to a community clinic. You just said a minute ago you would not have gone. So you would be a statistic that is extremely expensive, perhaps even loss of life, because you didn't go, because you didn't have that capability to go someplace where you felt that you were going to get the kind of care and privacy that you needed. So I am deeply concerned about that. And you have a cancer survivor group through Planned Parenthood, which is awesome. But you must hear this all the time from people. So let me ask you the question that I hear from the other side. You can go somewhere else. What do those people tell you about going somewhere else?
A very rural area of Wisconsin. I live in Speaker Paul Ryan's district. And people in rural areas already struggle to get to their doctors. And I know, the last thing that the majority of my neighbors would want is less access to healthcare and less access to doctors. I saw a poll recently that said 55% of Paul Ryan's constituents are against defunding Planned Parenthood. They want Planned Parenthood to remain funded. The community health centers in my area, of which there are only 2 in the district that provide reproductive health care and cancer screenings, so would be comparable to Planned Parenthood. They have waiting lists that take weeks to get in. So, you don't know what could happen in those weeks, how quickly things could spread. If you were a young person like I was when I went to Planned Parenthood, what can change in weeks? You forget, you decide not to make the appointment. Especially people who are sick or worried about a lump, like some of my friends from the Cancer Survivors Network of Planned Parenthood. You can't wait several weeks, and Planned Parenthood can see patients sooner, and that's really the standard that all healthcare centers need to be held to.
Okay, thank you. And Mrs. Johnson, I want to ask you, because this is one that I understand a lot about, cutting the essential health benefits that the House did would hit pre-existing condition, which we're hearing a lot of talk about, but it also would deal with the lifetime benefit cap that has been taken off because of ACA. How would that have impacted you?
Thank you. Well, there are months when my daughter's medications cost more than my husband makes in a month, and eliminating essential health preventive measures that keep people healthy, that's just unconscionable to me. And so struggle to keep her healthy. And again, there were a lot of things that weren't covered by insurance, but a lot of things that were. And again, there were so many expenses that were piling up besides what was covered in this policy. But when you were looking at the numbers under the policy, if she had reached her lifetime cap, family would have lost their health care coverage. So not just my daughter, but then it's this kind of collateral damage. So everyone in our family would have been care. And because by some insurance companies, just having Down syndrome itself is considered a pre-existing condition. I have a friend who denied coverage when their child was born with Down syndrome. They were told they could not put that child on their family's policy because they were born with Down syndrome, because that's there from the very beginning. So, and these healthcare costs for these families pile up so quickly, and those and annual caps, quite frankly, are literally the lifeline, so that they can make sure that they can pay for their child's medications that month, or their treatments, or whatever it is that they're needing access to that month. So,
well, thank you. Thank you again to all of you. Really appreciate it.
Thank you so much. Senator Booker, welcome.
Thank you. It's tough. I just want to thank you all for your testimony today. And, it's home because the stories you share are stories that I've seen myself in my own state, and from people who tell me that the Affordable Care Act literally, once they were able to sign up, it just changed their lives. And when you're struggling, and you all tell this story so courageously, that to have to struggle with an illness alone, but then to add on to it the anxiety, the stress, and the worry, I would even say the trauma of not knowing if you're going to be able to balance your illness with rent or with food. Ms. Hardaway, to talk about just having had a dad with Parkinson's, and I was just talking with my mother about you're fighting just to hold on to your dignity and to do the things that people take for granted. And to think that I live in a country where, and this is what got me last week, because I'm just a guy that was taught to love and respect everyone, but to watch people pass a piece of legislation and literally not even know what the hell it would do to the country and to their constituents, and to be able to shut out the voices within their own districts of Democrats, Republicans, independents, people that don't give a damn about politics but want to stay alive or want their family not to suffer. And so to have you all be willing to come here to Washington and tell your stories, we've been talking about this a lot as just a group of friends, and I'm sitting with people that I've come to love in the short time I've been in Washington. And so I just want to repeat the urgency for more people to follow your lead and to tell their story. I mean, we just need more Americans to be willing to let folks know what this really means, not in data, not with statistics, but real American voices. Because you can't listen, you know, Mr. Dunkley, I can't listen to you without hurting, just listening to what you endured. I mean, first of all, you give you know, talking about gender, you just give a model of manhood, of your willingness to fight your own illness, to be the kind of husband to your wife, and to profess the love that you have. So I just want to take a moment to ask more people to do what you all are doing. We don't need a hearing. We're talking about millions of Americans that are enduring the anxiety right now, watching Washington, D.C. hold their families' well-being in the balance. And I'm hoping more people will post their stories, like we heard about Senator Van Hollen's website. We're asking people to put America Speaks Out. We should have the largest hearing in the history of America, with more people willing to push their testimony out there, share their stories. And that's really what I want right now, because I can't sit through listening to your truth without feeling everything I believe this country should be and stand for at risk. And the commissioner said it right. This ain't a perfect law, the ACA. But if we take all the ground we gained and allow it to go backwards right now, to thrust other Americans, and I'm not just talking a handful, I'm talking about millions of Americans back into the reality. And this craven idea that someone who gets a disease is somehow lesser, or it's their fault, that they should suffer. Who am I that a millionaire, should have to pay for your medical costs? So I apologize for using all my time not to ask you questions, but I heard, I mean, how much, Ms. Johnson, you're just sitting there telling the stories of your friends, the people that you know. And this is the most pernicious, evil type of privilege that says that if a problem is not affecting me or my family, then it's not really that much of a problem. But you can be damn well sure that if it was a congressperson and their health, or the health of their spouse, and this was going to affect them, you can be damn well sure they would not have passed this law. And so this is a time where silence is the worst enemy of what we're trying to do. And we need more people to speak up and speak out, because this is a test of what kind of country will we be. Where is our heart? Where is our compassion? And don't tell me the nation that can send human beings to the moon, that could map the human genome, that could literally have the largest military force known to humanity, can't design a healthcare system that can't protect the most vulnerable of its citizens. I don't want to hear another mother tell me about the fear that they have that their child won't be able to live free or healthy because we have designed a system that shuts them out. So I just want to thank you for your stories and your testimony, and I pray to God that we can get more people to do the same, so that we have a chorus of love and conviction that is so loud that no congressperson, no senator can shut out the truth that you all are giving us today. Because there's no way anybody can believe that we can't figure out a way to provide coverage for all Americans. So thank you very much.
Thank you very much, and I would just say amen. Thank you. Thank you. So, Senator Kaine, thank you so much.
Thank you, and thanks to all of you. And I just want to pick up on what my friend Corey was saying. Ms. Johnson, as you started to testify, tears just started rolling down my face. And I've heard a lot of stories like this, and I'll tell you the reason I was crying is the people who passed this law, they could care less what any of you think. They could care less what any of your experiences are. When the House was considering the first version of the bill, they had 3 hearings. There was a hearing in the House Energy Committee in February on Medicaid. They didn't allow any patient witnesses. There was one in the same committee in February about the collapsing health market, they allowed somebody from the American Cancer Society and one insurance commissioner to speak. And the House Ways and Means Committee had a hearing on the individual mandate. They didn't allow any patient witnesses. When the version came up that they voted on, they didn't have any hearings. They didn't have any witnesses. They didn't allow any amendments. They didn't even wait for a CBO score to tell them how many people would lose insurance, how much more people would pay, and how folks with pre-existing conditions would be affected. They did not care one bit what any of your experiences were. And the reason we've invited you here today is we're afraid the same thing's going to happen here in the United States Senate. When the Affordable Care Act was passed in 2010, let me tell you the way the Democrats handled this. The Senate Finance Committee had 53 hearings. The Senate Help Committee had 47 hearings. The final Senate bill on the floor included 147 Republican amendments that were offered by Republicans and passed. And even though the Republicans made a political decision to oppose the bill on the floor, they proposed amendments that Democrats in good faith considered. And in writing the bill, the Democrats who wrote it in 2010 included stakeholders like you and listened to them to try to craft a bill. We've invited you today because we are deathly afraid. What we're hearing from our Republican colleagues here is that they have their group of 12 guys trying to come up with a bill that they can put onto the floor without hearing from one of you about any of your experiences and without allowing any amendments. That's what they're trying to do. And you saw what happened when the House passed that bill after refusing to listen to any of you. They went down to the White House in a bus and they had a big, big celebration, like they'd landed on the moon or something. This from a president who said over and over again, nobody's going to lose coverage, nobody's going to pay more, nobody with a pre-existing condition will ever get kicked around because of that. And the bill that they celebrated down at the White House didn't just break those promises, it shattered them into a million pieces and then drove over the pieces with a bulldozer and then poured acid on the pieces. Well, you can be darn sure that we're going to do everything to make sure we listen to you and that America listens to you and that we will not for a minute entertain anything in this body if we are given the chance, and we're going to yell as loud as we can and take the chance. We're not going to entertain anything that would break the promises that this president has made. Why would we vote for or allow something to pass that shatters promises that he made to the American public? We're going to hold him accountable and make sure that we don't do anything that doesn't meet those promises. And your stories really make a difference. Thank you.
Thank you so much. You can hear the passion. I mean, all of us are so appreciative that you're here and are absolutely committed to doing everything possible to move forward rather than backwards on providing health care for people and making sure it's affordable. Senator Franken, thank you so much.
Thank you, Senator Stabenow and Senator Murray, for having this hearing, and thank all of you for your moving testimony. And I see that Mr. Nelson, you were the Rural Healthcare Leader of the Year. Is that it? In Michigan.
Yes, Senator.
And of the United States.
Yes, Senator.
Okay, you see, Minnesota has a lot of rural health systems, and so. Understand that.
Yeah.
And and when I went around Minnesota on this one iteration, the first iteration of this bill, I heard from hospitals, from nursing homes, clinics, that this was terrible for rural health systems. How would it affect your system in terms of your being able to employ the number of people you employ? What would it do to your system?
We would have to come up with a strategy and cut. And There are 7 other hospitals up there that exist in counties that have some of the highest unemployment rates in the state. There are women in my hometown of Newberry, Michigan, that travel 100 miles to deliver their babies to Marquette, to Petoskey, and sometimes to the Sioux. We have delivered 3 babies in our emergency department in the last 3 years. We delivered a 4-pound preemie on Mackinac Island in our facility over there. So if 50% plus of our payer mix is Medicare and Medicaid, it's going to have a devastating effect on us and the communities, not only across the Upper Peninsula, but you've got 1,425 critical access hospitals in the United States serving rural America. Those hospitals are going to be hit hard.
All right, that's exactly what I hear. Commissioner Miller, you said that and I think we've heard how the law has helped people. You said it's not perfect. But one of the things you testified was about you have a sustainable market there in Pennsylvania, but they are arguing that there's a death spiral. And I'd like to ask you, to what extent have Republican efforts to sabotage the market what role they've played in driving up the cost in the individual market and making it increasingly unstable? I'm referring to Republican efforts to block risk corridor payments and the administration's refusal to commit to funding cost sharing, reduction payments, et cetera.
Thank you for that question, Senator. And there's no question, although I mentioned we do have a market that is on its way to being a stable market in Pennsylvania, there's no question that those actions have impacted our market in Pennsylvania as well as the individual markets across the country. And I think in Pennsylvania and in markets across the country, one of the impacts is that families have not had as many choices of health plans as they would have otherwise, because all of their actions have made the individual market an unattractive place to participate, and just simply not a market that a lot of companies want to be in. And I think this is a really important point, because the very people who are claiming that Obamacare is failing are the very people that have done everything they can to undermine the law every step of the way.
Exactly.
By, as you mentioned, eliminating, essentially not paying all the risk corridor payments that were made. They knew exactly what they were doing when they did that. Not giving the assurances to insurance companies even now that cost-sharing reductions will continue. These are payments that help low-income people pay their out-of-pocket cost-sharing when they go to get care. And those flow through insurance companies. So once again, the Republicans who have done this, they know exactly what they're doing with this. These actions have been very targeted, and the goal has been to undermine the individual market and to make Obamacare fail. And unfortunately, in some cases, they've gotten close to actually being successful. I think the good news is, in places like Pennsylvania, I've worked really closely with our carriers, recognizing that this hasn't been a very attractive market to participate in because of a lot of these actions. And we feel like we've put our market on a path to stability. And it's really all the uncertainty and the discussions happening in Washington, D.C. right now about repealing the ACA that is causing companies to continue having that conversation about whether they want to continue participating in this market. I feel pretty optimistic that the companies in Pennsylvania that are still on our exchange, and we lost 2 last year, but we still have 5, I'm optimistic, I'm cautiously optimistic that they're going to remain in the market for 2018. But we're going to get plans and rate filings on May 22nd is our deadline. So we're literally a week and a half away from getting those filings.
And they're living under this uncertainty right now.
For 2018, and they don't know what the rules for 2018 are. So the Republicans have made this as unattractive a market as they possibly can. And despite that, in places like Pennsylvania, we still feel like we're getting back to a more stable market.
And I'm finishing, but while we're sitting here cheering up, and want to thank you for your testimony, they're cackling. This is really reprehensible. Thank you all.
Thank you so much. Senator Markey.
Thank you all for being here. You make us feel better because you're here and you're fighting. You're like walking, talking antidepressants for us. You give us a reason to know that we have to fight every single day to make sure that the House of Representatives healthcare bill never becomes the law of our nation. And we are going to do that. We are going to fight every single day. Their plan is a very simple plan. Cut Medicaid by $880 billion for the poor, for the sick, for the elderly, for the disabled, for veterans, and then package that $880 billion as a tax break for the wealthiest people in our country. That is immoral. That is inhumane. And we will not allow that to happen. If you kick these Republicans in the heart, you will break your toe. How they can harm the most vulnerable to create a tax break for the most well-off, for the most healthy, for the most wealthy in the history of our country is absolutely, totally wrong. But they do it because they harbor an ancient animosity towards every one of these programs that they never wanted to see be put on the books. Medicaid and Medicare and all of these programs. And so they are going to do their best to leave these programs as debt-soaked relics of what they look like today, if they could be successful. But we will not let them do it. We are going to fight every single day to make sure it never happens. And so the senators who you see here today are going to make sure that that does not happen. But we're going to need the whole country to rise up to fight against their cruelty, against their intent, which is not to help people, not to make people healthier, but in fact just to create the funding for the tax break for those who do not need it. I would like to turn, if I could, for just a second to this opioid epidemic and the fact that 2.8 million Americans right now receive coverage for addiction treatment in the Affordable Care Act. And if they are successful, they will put into danger the treatment that those 2.8 million Americans are now eligible to receive. So Commissioner Miller, could you please take that issue and tell us from your perspective what the consequences are to all of those people who receive that coverage if it is removed, if they are not covered for treatment, in terms of what the impact will be on the individual and their families.
This is a huge concern for us. Access to mental health and substance use disorder treatment, those were services that in the pre-ACA world often were not services people had access to. And obviously in Pennsylvania, the opioid crisis is having the same impact that it's having, I think, across the country. In Pennsylvania, between the individual market and our Medicaid expansion, we've had over 175,000 Pennsylvanians who've accessed substance use treatment disorder because of the Affordable Care Act. In Pennsylvania, 175,000 people would be the third largest city in Pennsylvania. That's a lot of people. Obviously, the impacts that this crisis is having on families and on communities is unreal. And so eliminating or putting at risk coverage for these services is unthinkable at this point. And I sincerely hope that's not where we end up going.
If people were dying across the country at the same rate they're dying in Massachusetts, that would be 100,000 deaths a year from opioid overdoses. It would be 75,000 people a year dying from fentanyl in their system. We need more treatment, not less. There isn't enough treatment today, much less stripping away the protection these families receive from the Affordable Care Act. So thank you all for being here. That's just one example. There are so many more of how it transforms people's lives because that law is on the books, and how their lives would be transformed yet again if it was taken off the books, but in a way that is so horrific that it is imperative that we work every day to make sure that they are not successful. So thank you for being here. Thank you, Madam Chair.
It reminds me of when I was in the Upper Peninsula just a few weeks ago, talking to small businesses and asked them their number one challenge, and they said the opioid addiction and how it's affecting their ability to get employees and wanting to see more treatment and prevention and education. So thank you so much for raising that. Senator Blumenthal, thank you for being with us.
Thank you, and thank you so much for having this hearing, Senator Stabenow, which I think is so important because we are trying to educate Americans about the real-life consequences of this bill, as my colleagues have mentioned before now. They've been very eloquent while I've been here. I can't match their eloquence, particularly Reverend Booker. And I've been talking all day, so I'm getting a little tired of hearing myself speak. And we are here to listen to you. My question really is, if you have any suggestions for us, how we can raise these issues with Americans so that they better understand. Obviously, you have friends and neighbors, they know your situation, or maybe they don't. You know, people don't walk into the supermarket and start shouting about a relative who has cancer or a child with Down syndrome, or, you know, people tend to be private. And I'm wondering how we can make more Americans aware of the really powerful stories you've brought to us, and I'm very grateful you're here. But do you have suggestions for us? Yes, sir.
Available where people can easily speak and perhaps upload. You know, 30 years ago, I worked in telecommunications where the first cell phones we sold were $2,500, $3,000. I worked in beepers back in the days when dinosaurs ruled the earth. Today, everyone has phones that can broadcast in HD. But the main thing is that people feel isolated and they don't have a portal, something that you'd mentioned the hashtag earlier, where the shared stories make you understand that you're not in it alone. Illnesses in particular become compartmentalized. You're focused on getting through that day. And then the clouds of financial uncertainty and laws that have not been revealed, that things are done in darkness and the people despair, but they feel alone. And so if there were a way that people could safely share as much as they wanted to, you know, the privacy obviously is important to people, but without knowing what the person next to you is experiencing, you have no way to walk in their shoes. Again, I get back to empathy, of being able to understand that we're all connected together. And I am hopeful I reveal it back to when it was said in a hearing that at long last, Senator, have you no sense of decency, of shame? That goes back some years. But again,
to McCarthy, I think.
Yes,
McCarthy.
it was. It was, and that was the one that broke that particular story to the point where people said, my goodness, this is just not fair. It's just not right. But again, you feel so alone when you're fighting your own battle. So if there were ways that citizens could vox populi in a way that it adds to the shared story, which gives us more information to make the correct solutions. I'm just curious, is there any timetable whatsoever before whatever is going to be produced by the Senate actually hits the floor? My understanding is it cannot be filibustered. It's part of the Budget Reconciliation Act or something. It's going to take at least several defections, as it said, and I hate that word because it's basically, where is the human heart? You mentioned it's made of stone, but I still believe that, again, everyone feels this pain. So we share it together, and hopefully we can get some hearts to soften and do the right thing because it's the right thing to do. And sounds simple, but we appreciate the help that you all provide. One person standing on the corner with a mimeograph sheet, broad sheet, you might reach 5 people. But through the power of the connected world now, one statement can reach billions in minutes. And so all I came here today was to tell the truth on my story. It didn't need embellishment. It was visceral, it's real, it's ongoing, but I feel encouraged that there are mechanisms and people who care who have access more to the levers of real power. So we live in interesting times, and we're on this voyage together, and I look forward to a successful docking in some land of happiness and safety.
Well, thank you for that very eloquent statement. And courage and strength to be here today, because I do think that your stories, and we will make sure that they are communicated, will have an effect. And I'm thinking more, not of what we do in the United States Senate, which is a bubble, maybe with a slightly higher platform, but still a single entity, what we can do to spread this word. I've been having town halls around my state and asking people come forward with their stories. And I'm amazed by how many of those stories concern healthcare and how many of their fears and apprehensions concern healthcare. So it's not just the folks sitting at this table. It's really widely felt. And again, many, many thanks for your help.
Well, thank you so much. And let me stress again that we invite people to join us at #AmericaSpeaksOut or #Trumpcare. I welcome certainly people coming to my Senate Facebook page or website, as well as I know my colleagues do. I believe we have at least one other colleague that may be joining us in a moment. So I'm going to ask a couple more questions, and also want to just indicate, Mrs. Johnson, as a aunt of a wonderful young man, a wonderful nephew who has Down syndrome, who's now 30 years old and doing incredibly well, and he's working, and he actually co-directs the Michigan State University pep band at basketball games, and we are so proud of Barry. He is doing incredibly well, and with a devoted family, and fortunately had a dad with insurance that was willing to cover him, but it was really just good fortune that happened at the time. We've talked a lot about Medicaid, which is so critically important, but we also know that majority of people get their insurance through their employer. And one of the concerns that I have that's not been focused on a lot about the House Republican bill is that there's a gigantic loophole in it where they speak about a state can get a waiver to make it even worse by waiving everything. But they don't talk about the fact that if you are a multi-state employer, which we have one, we're proud of our manufacturers and others in Michigan, they're in multiple states. And the loophole says that if you are in a state, just one state, maybe you are in 5 states with your business, but one of those states decides to do a waiver, that you essentially can pick that state as your domicile for health care, and then all of your employees are affected by not having the essential benefit package, maternity care, mental health, addiction services, maybe hospitalization, prescription drugs, all of those things that we consider basic care. So, and we go back to the days of when you could get a cheap policy. And I remember so many people coming to me and saying, I've had health insurance for a long time, but then I got sick, and I found out it didn't cover hospitalization. So I feel like that ad that's on TV where they tell you, the good news is it covers zombies if you get attacked by zombies, but it doesn't cover anything else. So we don't want to go back to those days. And so I'm wondering, Commissioner Miller, if you could speak a bit about people who have employer-sponsored insurance and how you would see these changes in healthcare affecting them as well.
Who have Medicaid coverage and people who have coverage in the individual market. But we certainly know that those are not the only markets impacted. According to the CBO, Trumpcare, the AHCA, will likely result in fewer people getting coverage through their employers because the proposal eliminates the employer mandate, which will likely result in more employers not offering coverage. So I think that's certainly one impact that could be a significant impact. And then, of course, you'll see more people in the individual market and running into the same issues we've talked about with the individual market as well.
Great. Thank you very much. And what effects do you think that waiving the prescription drug benefits would have on individuals' ability to afford prescriptions?
Thanks for that question. I'm actually going to talk about a particular individual. Linda, who's a 60-year-old woman in Beaver County, has multiple sclerosis. We've heard some stories on this today. She relies on a drug called, I believe it's Tecfidera. Did I pronounce that right? She's on a marketplace plan, and she was told by her pharmacist that this drug could cost her as much as $12,000 per month without insurance. This is only one of 15 drugs that she takes. Without drug coverage, even if you consider the discount programs that she would have available, it would be easy to say that her drug costs could be as high as $20,000 per month. As a person who's had MS for 24 years, she relies on these medications to support her mobility and independence. So I think you would find that many people would not be able to afford prescription drugs without access to health insurance that covers this benefit. Prescription drugs are obviously a critical part of care for people with health needs across the board. People with cancer or diabetes, high blood pressure, hepatitis C, all of these people need medications to get and stay healthy. We also know that prescription drugs are the fastest growing cost in our system, and we know that there are some drugs with very high prices. So I think the impact on consumers of having to pay these costs directly would be absolutely devastating in a lot of cases.
Thank you very much. Mrs. Johnson, what does the regimen of care look like for you on a daily basis? What does that look like?
Thank you, Senator. So I was asked this question actually last week at Bloomington Hospital as I was giving a talk there to physicians, nurses, social workers, people working for Child Protective Services, just a whole set of kind of like a systems of care sort of unit in our local community. I was asked that question, and I actually put it back to them and said, I just want folks to just take a guess on the number of appointments that my daughter had in February. Shortest month of the year, only 28 days. I just started taking comments from those in attendance, and then finally I spoke back to them, and none of them had gotten it, and not nearly as high, and it was 27 appointments that my daughter had just during February alone. I really can't overstate how that affects my ability to work outside the home because the level of care that my daughter requires, not just every day, but just getting her to appointments. There's just a great deal of time and resources that takes away from other expenses that my family faces. So we get up, we rise early because she starts her day with a 1-hour flush and a daily infusion that takes about an hour, and I do a dog and pony show to keep her on, keep her attention during that time. We then take her to school. She's actually at a specialized school currently, so we can't get transportation. So I will drive her there, or my husband will each morning. And then almost inevitably, there are multiple appointments throughout the day that I will need to go and pick her up again and take her to different clinics or to get an x-ray at the hospital for ongoing treatments for her GI issues and such things. So that's just a normal day in our house. And then, and actually just today on the way over here, as we were walking to this room, I got a call from one of her specialists to discuss changes to her medication dosages. And so this is just, it's kind of par for the course. I mean, there's not a day that goes by that I don't get a medical bill in the mail and that I don't speak with one of her specialists or speak with someone who's involved in her care to try to continue to provide what I believe is the quality that she needs and deserves.
Thank you so much. And she's lucky to have you as a mom. Senator Elizabeth Warren, Senator Warren, welcome. We have had a wonderful hearing, very powerful testimonies, and we're so glad you could be here.
Thank you. I want to say thank you very much to Senator Stabenow for pulling this together for everyone, how much this matters. These are hard to do, and the senator has been hurting all of us and trying to get it together so that we would have a chance to put real faces behind the story of what happens if the Republicans are able to repeal health care for so many millions of Americans. I am also grateful to all of you for being here. I'm sorry I haven't been able to be here for all of the testimony. As I'm sure you've heard, there's a lot going on today. But it doesn't mean that we can turn away from this critical issue. You know, it hasn't even been a week since the Republicans voted in the House to tear up our health care system, to rip away coverage from the people who need it most, to open the door to discrimination based on pre-existing conditions. And now that they are going after Medicaid and after private health insurance, including employer-sponsored health insurance plans, no one is safe. No one is safe. And that has to be the message that we underline today. You know, Republicans aren't just taking away health care coverage. They're also tearing apart the financial security of millions of American families. You know, a law that says that insurance companies can't charge people more if they have a pre-existing condition or that they can't stop paying benefits for people who have cancer or whose medical bills exceed a certain preset dollar amount isn't just a health care law. It is a law that protects people from crushing medical bills, from home equity lines of credit that could cost them their home, from foreclosures, and ultimately, for many, from bankruptcy. So I just wanted to see if we could explore that a little bit more. I know that you testified earlier, Mrs. Johnson, about the time before the Affordable Care Act and Medicaid were available to you when your family struggled financially to try to make sure that you were covering your daughter's health care. Could you just say a bit about what it feels like when your family is in that position, when you know that the choices that you must make for the health of your daughter put your family's entire financial security at risk? You know, the kinds of things you think about at 3 o'clock in the morning.
Thank you. You're not asleep at 3 a.m. because you're up and you're concerned about you know, how you're going to pay those bills that just keep coming relentlessly. And I can say that I have a kind of a saying in our house: when your child is turning blue, nothing else matters. And for years, that was kind of where we were, just trying to make sure that if she wasn't breathing well, that that we attended to that. And there were times that I didn't have room to really think much about the financial devastation that it was causing to my family, because we were spending weeks at a time in the hospital just trying to keep her alive. And so when I would get home and find in my mailbox literally a stack of medical bills, I can't tell you what that would do to my spirit. I just would feel crushed, to be honest. And yet I still had to pick up and keep going for the sake of my daughter, because I didn't know when that next hospitalization was coming. So we just carry on.
Yeah. Bless your heart. But a reminder of how important it is to have Medicaid, how important it is to have. Mr. Dunkley, I understand that over the last few years, you have received bills for tens of thousands of dollars for your cancer treatments and your hip replacement surgery. If you hadn't had insurance through the Affordable Care Act for these costs, can you just say a word about what you would have done, what your life would be like?
My wife, Suzanne, who has advanced multiple sclerosis, I am her caregiver. During the cancer diagnosis that came out of the blue, it was very advanced. I was pretty close to dead. The mental strain just from that, but I knew that the Affordable Care Act was coming online, and it came online, and the costs I was able to afford. In the new world, say if they would offer me a policy, it might be 5 times as much, which without the subsidy would be close to $6,000 a month.
Wow.
My wife's on disability insurance. I am currently on Social Security. I'd like to get back working again. I do audio visual work and narration, so I can work at home. I try to stay close because she needs me, and I wouldn't be anywhere else. I mean, that's where I want to be, is by her side. But this new, from what I understand of the new law, it is draconian, it is heartless. I went from a $7,500 deductible on my old COBRA plan to a 0 deductible. I went from a $15,000 out-of-pocket to an $1,807.50, which I passed 2 days after the healthcare.gov plan started because my next chemo was around $35,000. We would not be in our home. We would have had to sell it in extreme duress. We did have some family and friends that set up a temporary GoFundMe site. Again, these are ice flows on the river, and you hop from one to the next and hope that it will support your weight. And any time that we can focus on our own health rather than the clouds of uncertainty, and my wife Suzanne is concerned every day. She stays up. It's hard to go to sleep because you wonder what you're going to read tomorrow. And sometimes it's worse than you might have imagined. So without the Patient Protection Affordable Care Act, I probably would not be here to speak with you today. I wouldn't have gotten finished with my treatment. The cancer would have probably killed me, or we would be living on the kindness of others. And I like to be able to pull my own weight, to be participatory, and that's where I think sharing our stories, we're not alone, but we need a mouthpiece. We need a way to get the story out that, we feel good at. And I'm just glad to be able to talk. My story is pretty simple, but it's the truth, and there are millions more like me. So thank you again for listening, for asking and listening.
Thank you. And to healthcare is a matter of life and death.
Yes, oh, absolutely.
For many people around this country. So thank you about your testimony on that, Mr. Dunkley. I just want to say, Senator McConnell didn't show up to today's hearing. All the senators were invited. He didn't show up to hear from any of you. But I just want to ask, for anybody who would like to answer, if Senator McConnell were here, what would you like to say to him? He's about to make the decision in the United States Senate about who goes forward on a health care revision and what that revision is going to look like. And if any of you just have a short statement that you'd like to give to him, I'd like to be able to hear it. Ms. Hardaway, we're going to record.
Why? When was the last time that you were told you could not go to a doctor because they didn't take your health care, your insurance? Medicaid is not for the poor. Medicaid is for those of us who need health care as desperately, if not more so, than anyone else in the country. Commissioner Miller was talking about her friend whose medications cost upward of $20,000 a month. I am an MS patient as well, and mine are there. Without them, I would not be a contributing member of society. I would be in a wheelchair. I don't want to be in a wheelchair. I enjoy working with my babies. I am a substitute pre-K and kindergarten teacher, and I love them. They are my joy. But the fact that I have medications available to curb the tremors, it's a little bit daunting when you're working with a 5-year-old and all of a sudden your hand, because they're, Miss Carol, are you okay? You know, they're they're babies. And without that, I could not have that gift. And I would like to ask if he would walk in my shoes for 1 month. I had a very devastating incident last week where I had an exacerbation, and I'm sure Mr. Dunkley is very well aware of these, and to the point where I could not pick my foot up high enough to put my own pants on.
Yeah.
That's not okay.
Yeah.
That's not okay.
Thank you. Thank you. Anyone else have a message? Yes, Ms. Walkington.
Thank you for giving me the opportunity to say this. I would like to say that this bill is terrible for women. Blocking access to Planned Parenthood blocks access to preventative care, cancer screenings, which saved my life. And it takes away essential health benefits like maternity care, pre-existing condition coverage. Having a C-section would be a pre-existing condition. Surviving domestic abuse would be a pre-existing condition. They're all horrible in and of themselves, but collectively they're just atrocious. And the second thing I would say is, because this is so devastating to women, there need to be women at the table when they are considering this bill, considering revisions. Women need to have a voice. So thank you.
Thank you. Thank you, Mrs. Walkington. Anyone else want to add anything? Mr. Nelson does.
Thank you, Senator Warren. By the way, I saw you about 4 years ago speak. Very impressive. Thank you.
Thank you.
I would tell Senator McConnell to set aside ideology, to bring in healthcare leaders like Rick Pollack from the American Hospital Association, and learn about the complexity of healthcare. I would ask that they approach it like Michigan did. You had a Republican governor working with a Senate minority leader, Gretchen Whitmer. You had the support of Senator Stabenow, Senator Peters, Senator Richardsville, who was Republican, and it was a bipartisan. They involved the Michigan Health and Hospital Association. Brian Peters, our wonderful CEO, engaged the association. Laura Oppel is with me, Senior Vice President from the MHA. And so it was a group effort. And there were factions of the Republican Party that didn't want it to pass. But it was a UP senator that threw the vote over. So that's what I would recommend.
You know, I should add on that. You know, that's how we did it in Massachusetts. Democratic legislature, we put together health care coverage because we believed that health care is a basic human right. And we wanted coverage for everyone and to find ways to lower the cost to make that happen. We recognized we didn't get it right the first time out. We had to go back, we had to readjust, we had to amend, but we've tried to do that in a very bipartisan way and to make it work. And I agree with you. I think it's a very powerful point, Mr. Nelson. Have we gotten everybody who wanted to speak on this? I just want to say one more thing. You know, I never expected to be in this job in the United States Senate. I worked as a law professor for most of my adult life, and I researched why people go broke and did studies on bankruptcy. And the data are really clear on this. People who go bankrupt are pretty much like everyone else, pretty solidly middle-class folks, people who get a decent education, who at one point have good jobs, who buy homes, who have children, and who get hit hard, often with a bad medical diagnosis that just turns them upside down financially. It's one of the biggest reasons that families declared bankruptcy back when I was studying it, was because of serious health problems. Since the Affordable Care Act was passed in 2010, Bankruptcy filings have declined for 6 straight years. In fact, bankruptcy filing rates are now 50% lower than they were when the ACA was first adopted. I don't want to go back to the days when families risked losing everything if they got bad news from a doctor. I think it is immoral for the richest nation on earth to say to millions of our people that if you get a bad diagnosis, you could lose it all. Your savings, your home, your future. You are the people who came here to put a face on what it means to have health care in America, and I'm deeply grateful to you for doing this. Believe me, Senator Stabenow and I and every single Democrat in the United States Senate will be fighting on your behalf and on behalf of all of the people you have spoken for today. Thank you so much for being here, and thank you, Senator Stabenow.
Thank you so much, Senator Warren. I'm so glad that you're here. And as you're talking about bankruptcies, I can't help but share a recent story in my family where my nephew and his wonderful young wife just had a little baby girl, and she was born with half a heart. And she spent her first 7 months at University of Michigan Children's Hospital with her mom and dad by her side. It's amazing how life works, because her mommy is a pediatric intensive care nurse. And so Allie's been by her side, as well as my nephew Mac. And when I think about this, she's now home, but I think about if there were caps on treatment, if there were pre-existing conditions that little Leighton will certainly, she has one more surgery to go through. And if, in fact, my brother, who would do anything in the world for his family, had had to pay for that, he would have, and we could very well have seen a bankruptcy, very well, in the because of the incredible cost of little Leighton, who is now a beautiful little girl, 18 months old, and is going to have a good life. This ought to be something we celebrate. This is what it's all about. And there is I just want to end just in terms of differences, unfortunately, in philosophy right now between what we are seeing coming from the Republicans, certainly in the House, and where we are. And my wonderful technology keeps bouncing here. Let me see if I can do this. When they passed this in the House, this is what actually made my hair turn red, on fire here. There was a quote in the paper, Republican U.S. Rep. Mo Brooks of Missouri crowed that the bill under consideration would, quote, allow insurance companies to require people who have higher health care costs to contribute. I can get this back up again. This is not, would allow insurance companies to require people who have higher health care costs to contribute more to the insurance pool, thereby reducing the cost to those who have lived good lives. My little grandniece, Leighton, at 18 months old, has lived a good life. Each of you, your daughter, each of you, have lived a good life. And those kinds of statements don't belong in our great country when we're looking at something that fundamentally should be a right, not a privilege for those who can afford it. So thank you so much. We will keep fighting, and we hope you will keep speaking out. And as I indicated before, I hope folks will go to #AmericaSpeaksOut or #Trumpcare, and let's continue the discussion. Thank you.
Thanks for holding it up.